Hello everyone, I'm DNB first year resident in Respiratory Medicine Department at INICET Apollo Hospital, and I'm making this video to just guide my fellow juniors who will be giving NEET PG in some days, to let them know about this branch, because when I was in your state last year, I have no clue about respiratory medicine as a branch. But since now I'm in a position so that I can guide you, I'll be like just making this a short video to just tell you something about this branch and how should you approach after you need PG. So, telling you specifically about respiratory medicine as a branch, I'm pretty sure some colleges must have a respiratory medicine department in their colleges, and they mostly deal with TB and all. And most of us has a view that respiratory medicine is all about TB. That's not the case. It's actually not the case. So, respiratory medicine is a branch where you mostly deal with the, of course, as the name suggests, respiratory issues. But respiratory issues are a lot. Like, we are dealing with, because every second or third person present with the complaint of shortness of breath, whatever is the issue, whether he's having cardiac issue, whether he's having abdominal distension, he will have a shortness of breath. So shortness of breath, you are got to person. So we are not dealing just with the TB cases. We deal with the asthma, we deal with the COPD, we deal with the ILDs, we deal with all the foreign body. Like if there's some foreign body in the tract and it has been stuck, we are the go-to person through bronchoscopy who will like pull that foreign body out. So yeah, so you have an idea that it deals with a lot of respiratory issue. But one thing that I didn't know when I was in a position, that it also has a critical care part of it. Basically, all the ICU care, at least in my hospital at in the Apollo Hospital, respiratory medicine department is the one who like handles all the ICU care. So I have an exposure of all the ICU care, all the C lines, A lines, intubation, ventilator settings, all are handled by us, and we are also dealing with the that respiratory part. But when there is a critical care part involved, we are dealing with all the issues. Someone's sugar is not controlling, someone's BP shooting up high, someone in ARDS, and have to change the ventilator settings. We are dealing with all things at once. We are getting a good medicine exposure. We choose respiratory medicine, and it's the case with everyone that when we are not getting a medicine seat, but we want a medicine, we want to go into a medicine line, so we choose respiratory medicine, and it's a really good option. I can vouch for it, because it gives you the same feel as like medicine. There's intervention involved in it, like bronchoscopy and EBUS procedures, thoracoscopy, a lot of procedures. And it's really exciting, because I didn't want to go into a surgical field, but I at the same time wanted a bit of it. We do IGD insertion, we do pleural tap, and it's really, it's thrilling. It's not boring, if I summarize it. And so yeah, I've told about respiratory medicine as a branch and what all it includes. The second thing is, a lot of people ask me, should we choose DNB or MD? I would. It has the same answer as medicine. Why people choose DNB medicine nowadays over MD medicine? In the same case, because the procedures like bronchoscopy and EBUS procedures are like not seen in the government setting, because it's a very costly procedure, and it's mostly seen in the corporate hospitals. And it's very important that you get an advocate exposure of it during your residency. So as I'm in Apollo Hospital and I get a lot of procedures, I get my consultants are really good, and they let me do the procedures also. So yeah, I'm getting a very good exposure, and I'm pretty sure I would have got that same level of exposure if I would have been MD. So yeah, I was making a lot of videos on how should you approach and how should be your decision, which decision you should take at your rank. And I'm just giving an idea that respiratory medicine is a good branch and you should really go for it. if you are if you have a medicine acumen and you want to proceed it in further, and you're not getting any good medicine branch. So yeah, I'm making a lot of videos. Do share, do like, and do tell your doubts in the comment section. I'll be answering your doubts. Bye bye.